Hello friends, and welcome back to my channel. Today, we're talking about the alarming signs that your cholesterol is too high. Now, high cholesterol is a silent threat. It doesn't cause pain, it doesn't give you a fever, and it doesn't make you cough. And that's exactly what makes it so dangerous. Your arteries could be clogging right now. Your blood flow could be slowing down, and oxygen could be struggling to reach your brain or your heart, and you'd feel absolutely nothing. That is until one day something snaps, a heart attack, a stroke, a single moment that changes everything. But here's the thing, your body isn't completely silent. It whispers. It gives us clues, unusual signs we might brush off or blame on something else. These aren't the textbook symptoms you already know. These are patterns, subtle changes, physical signals that something deeper is going wrong inside your blood vessels. In this video, you'll learn the 12 most overlooked signs that your cholesterol is dangerously high. These are the warning lights most people miss, until it's too late. Sign 1. A gray-white ring around your cornea. Take a close look at your eyes in natural light. If you see a pale, gray, or white arc forming around the outer edge of your cornea, it could be more than just aging. This is called Arcus Senilis, and it shows up when cholesterol-rich deposits build up around the edges of your eye. Now, in people over 60, it's fairly common and not always linked to heart issues. But if you're under 50 and you see this ring, that's a red flag. Studies have found a strong link between this and high LDL cholesterol, especially when combined with low HDL. It doesn't affect your vision, so it's easy to ignore. But it's a visible sign of what might be happening inside your arteries, cholesterol building up and silently narrowing your blood flow. If you spot this, especially with other risk factors, get your blood tested. The eyes don't lie. Sometimes, they're the first to reveal what your blood is hiding. Sign 2. Numbness or tingling in your legs or feet. If you're feeling pins and needles in your feet for no clear reason, don't just ignore it. This isn't always just poor posture or a pinched nerve. It could be a sign of poor circulation caused by clogged arteries. When cholesterol builds up, it limits how much oxygen-rich blood reaches your lower limbs. The result? Numbness, tingling, or even a burning sensation in your toes or feet. This isn't that one-time feeling after sitting cross-legged. It's a pattern. It might come and go, or it could get worse when you're walking or at night. If it becomes regular, it's time to check your cholesterol. Your peripheral nerves are highly sensitive to blood flow. When that flow is reduced, they misfire. That strange tingling could be your body's way of warning you before something more serious happens. Sign 3. Yellowish bumps on the skin. Those small, soft, yellowish lumps under your skin might seem harmless, but they can reveal a lot about your blood. These are called xanthomas. They're literally deposits of fat and cholesterol that collect just below the skin, often on the elbows, knees, ankles, or around the eyes. They don't itch or hurt, and because of that, people often dismiss them. But they're directly linked to very high levels of LDL cholesterol. If you notice these bumps, and you have a family history of heart disease, take them seriously. They're one of the few outward signs that your cholesterol isn't just high, it may be dangerously high. They won't go away on their own, but if you lower your cholesterol through treatment, they can shrink or even disappear. Sign 4. A heavy, tired feeling in your chest after activity. Walking upstairs shouldn't make your chest feel tight. If it does even slightly, pay attention. As cholesterol builds up in your coronary arteries, it narrows the space for blood to flow. When you're resting, your heart gets just enough oxygen. But during activity, it needs more. If it can't get enough because the arteries are partly blocked, you might feel pressure, heaviness, or tightness. This isn't the classic, dramatic heart attack pain. It might just feel like discomfort, fatigue, or strain, something you'd blame on being out of shape. But it could be a mild form of angina. It's the kind of symptom people ignore for years, until one day, an artery closes off completely. If your chest feels unusually heavy during physical effort, don't brush it off. Get checked. Sign 5. Frequent jaw or neck discomfort during activity. Chest pain isn't always the first sign. For many people, especially women, the discomfort shows up in the jaw or neck. If you feel soreness or tightness in your lower jaw, throat, or neck that comes on when you're walking or climbing stairs, and then eases when you rest, That could be a form of referred pain. Your heart is working harder, but blocked arteries aren't delivering enough blood, and the stress manifests in nearby areas. This isn't a toothache. It doesn't get worse when you chew. It's more of a dull ache that doesn't quite make sense, and that's what makes it dangerous. People go to the dentist or think they have a stiff neck, never realizing their heart is the real issue. Any unexplained pain from the chin to the collarbone that comes with exertion needs to be taken seriously. Sign 6. Erectile dysfunction in men. This is often blamed on stress, aging, or hormones. But in many cases, it's the first warning sign of clogged arteries, years before any heart symptoms appear. The simple fact is, an erection requires good blood flow. If cholesterol has narrowed the arteries supplying the pelvic region, that blood flow becomes weak or unreliable. Research shows that ED can appear 3 to 5 years before a heart attack. That makes it a powerful early indicator. If you're under 60 and begin noticing this, especially with other risk factors, it's worth checking your cholesterol. The smaller arteries are affected first, so problems here can point to bigger issues building up elsewhere. It's not just a bedroom issue, it's a circulation issue. Sign 7. Sudden memory lapses or poor concentration. We all forget things now and then, but if you're noticing sudden gaps in memory, difficulty focusing, or a mental fog that wasn't there before, don't just chalk it up to age. Your brain needs a constant supply of oxygen-rich blood. If cholesterol is narrowing the arteries to your brain, even a slight reduction in flow can affect how clearly you think. This is sometimes called vascular cognitive impairment, and it can happen before any signs of a stroke. You might struggle for words, forget names more often, or just feel mentally slow. These subtle changes can build over time. High cholesterol doesn't always scream for attention. Sometimes it just slows everything down. Sign 8. Visible cholesterol deposits on your eyelids. Look closely at the skin around your eyes. If you see flat, yellowish patches near the inner corners of your eyelids, you might be looking at cholesterol from your bloodstream. These are called xanthelasma. They're soft, painless, and don't affect your vision, but they are strongly linked to high cholesterol. While they don't always mean you have heart disease right now, they do point to a serious imbalance in how your body handles fats. Some people think they're just a cosmetic issue, but they're more than skin deep. If you see these patches, ask your doctor for a lipid profile. It's one of the few signs that lets you literally see the cholesterol trying to get your attention. Sign 9. Unexplained pain in your calves when walking. You're walking at a normal pace, and your calves start to ache. It's not a cramp or sore muscles. It's a dull or burning pain that shows up when you move and goes away when you stop. This is a classic sign of peripheral artery disease, or PAD. It happens when cholesterol narrows the arteries in your legs, reducing blood flow to the muscles during activity. It's easy to mistake for simple aging, but the pattern is the clue. Pain that consistently appears with activity and disappears with rest is often vascular. And PAD doesn't just affect your legs. It's a major indicator that similar blockages could be forming in your heart and brain. If your legs talk to you every time you walk, it's time to listen. Sign 10. Fatigue that creeps in too early. We all get tired, but if you're constantly drained by mid-morning, even after a full night's sleep, your body might be working harder than you think. When cholesterol narrows your arteries, your heart has to pump with more force to circulate blood. That extra effort demands energy. Over time, you feel worn out from simple tasks. This isn't the kind of tiredness coffee can fix. It's a steady lack of stamina. You might wake up okay but run out of steam by noon. This kind of persistent, unexplained fatigue, especially with shortness of breath, can be an early sign that your heart and arteries are under pressure. Sign 11. Shortness of breath from minor exertion. You walk across a room or bend down to tie your shoes, and suddenly you're winded, much more than you should be. This kind of breathlessness during light activity can signal your heart isn't getting enough oxygen. When cholesterol narrows the coronary arteries, even small tasks can leave your heart struggling. Many people blame aging or being out of shape, but if it starts suddenly or gets worse, that's not normal. It's an early warning. When blood can't flow freely, oxygen delivery drops, and your body compensates by making you breathe faster. This isn't just a lung thing, it's a circulation thing. If breathing feels harder than it used to, it's time to get tested. Sign 12. High blood pressure that won't budge. If your blood pressure is high and stays high despite your best efforts, cholesterol could be the reason. When plaque builds up along your artery walls, the passage for blood gets tighter. Your heart has to pump harder, and that shows up on the monitor. This isn't temporary, it's mechanical. You could be eating better, exercising, and taking medication, but if your cholesterol is still high, the pressure might not fully come down because the root problem is still there. High blood pressure and high cholesterol are a dangerous pair. If your numbers aren't improving, it's time to look deeper. So if any of these signs feel familiar, please don't wait. Talk to your doctor and ask for a lipid panel. This isn't about causing panic, it's about empowering yourself with prevention. If you found this helpful, give the video a like, subscribe to Farah Education, and share it with someone who might need to see it. Your attention today could truly change a life tomorrow.